We're all very happy to have y'all here. All right, perfect. Our workshop title, coincidentally, is the same title as our program manual. So for those who know how to maneuver through the Hoover space, it's a part of the attachments here. Please feel free, once this workshop is done, to look through, share it with others. If you have questions about things that you heard today, and as things may come up. Um, I will turn it over to Dr. Muhammad to kick us off with intros.
Good afternoon. My name is Dr. Arisha Muhammad Lewis. My agency is A New Vision for You. I am the cultural broker liaison for the Lancaster, San Fernando Valley, Van Nuys, and West LA, Santa Clarita offices.
Hello, everyone. Good afternoon. My name is Lindsay Jackson. I am a licensed marriage family therapist. I work with Shields for Families as the program manager for this culture broker pilot in SPA 6 area.
My name is Michaela Davis. It is often hard to pronounce, so more than welcome to call me Mika. All my loved ones do. I get to serve Los Angeles County's Department of Children and Family Services in a lot of different capacities. And in this capacity, I am the program lead for the Community Cultural Broker Program.
Good afternoon, everyone. I'm Orlando Hadnot. I'm the Community Culture Broker Liaison for Faith Foster Families Network. I also support the South LA teams, Vermont, Corridor, Compton, Carson, Hawthorne, and Water Ridge offices as the Community Culture Broker Liaison. I also manage the cultural brokers that assist families within our South LA footprint. As well as ensuring that payroll, things like that, recruitment, those are the aspects of my role with Community Culture Broker. And I consider myself a culture broker myself. So I am a culture broker.
Good afternoon, everyone. My name is Whitney Rostad. I am a public health researcher with the American Institutes for Research, which is a nonprofit organization that conducts behavioral and social science research to improve the lives of families, children, and communities. I have had the pleasure of working with this wonderful team for the past couple of years to support the Community Cultural Broker Program, including developing implementation resources like the program manual that Mika mentioned, as well as understanding the needs and opportunities for evaluation so we can start to build the evidence for this awesome program. So I think I'll turn it back to you, Mika.
Thanks, Whitney. We like to start with our why. It tends to center us when we're thinking about our practice and what we do. And as much as I tried to get away from math and become a social worker, one of the most important things that I have learned and that has centered my why is data, and how important data is when you're working with families, when you're advocating for families, and in particular for our program, families that have been historically disadvantaged. You get to see some terms on the screen here that are really important to us and the work that we do for the program. To explain things a little simpler, disproportionality is defined as the over or under representation of a particular group within a system compared to the percentage in general, in general population. So for child welfare, disproportionality occurs when a racial or ethnic group, such as Black children, is involved in the system at higher rates than their population, than their representation in general child population, meaning there's more Black children in child welfare care than children in general population walking around every day. For our team in LA County, our numbers are very specific. Black children make up 7% of our general child welfare, our general child population. They unfortunately make up 23 to 24% of our child welfare cases that we see. Disparity refers to unequal treatment or outcomes experienced by different groups within a system. For child welfare, disparity means that children and families of different racial or ethnic backgrounds receive different levels of services, interventions, or outcomes, and even face compared to their counterparts in the system. An example of this would be that there are more Black children in our system who are more likely to be removed from their families and spend longer times in foster care compared to their white counterparts. I identify as an elder millennial, and Kendrick is pretty popular right now when the team and I think about the best way to describe what a cultural broker does. This video is a really good demonstration of that. So let me cue it up for y'all.
Man, bro, so let me tell you what had went down. And I was 2 bands away from getting, bro, a whole barbershop, bro. Man, bro, so let me tell you what had went down. And I was 2 bands away from getting, bro, a whole barbershop, bro. Oh, my mama, bro. Peanut gonna call my phone talking about, I just got paid. I looked at the phone. You just got paid? What? Man, where the dice at? I'm ready to shoot. We can roll. Last time I shot with him, 1,300 in my pocket. Easy.
Off top.
Off top, easy.
So what happened?
What happened? Man, Peanut is what happened. Had me hot on my mama, hot. 7, 7, 7, 7. Back to back to back to back. Bro, I was mad. He was all in my bag, in my pockets, in my whole Duffy. I was ready to get out.
Basically what he is saying, he saved up his money to get a local barbershop. He then made a friendly business wager with Peanut in hopes to secure more money for his business. But eventually losing it all with one roll of the dice. Ray, what you think?
I think volatility is his problem, and I don't think he understands how to compound his talent and how to compound his money. What I mean is, if you just take big bets like that, you'll blow it all. You should invest in yourself, man, and then you learn more, and then when you learn more, you also make more money, and it compounds. You could have 2 barbershops, you could have 10 businesses, if you know how to compound.
Basically, bro, what he's saying is slow money wins the race. You can still have a big upside even if you don't throw all your chips in the bag. Invest in yourself, leave them dice alone. You don't need to invest in the dice. That's gonna ruin everything. Spread your money out, let it build for yourself and work gradually, slowly. Anybody that's ever made a lot of money didn't make it fast, you feel me?
Feel you.
Off top, PG Lane.
Cue a community cultural broker. And for the sake of LA County's love of acronyms, we affectionately call them CCBs. And so that's what we'll say throughout the presentation. The role of a CCB is vital for a Black family that is interfacing with a system that was not created to celebrate or acknowledge the nuances that are a part of their culture. Most commonly, CCBs are referred to as bridges. They often come from the same communities that they serve in and help to rebuild trust and repair relationships between families and systems. Cultural brokers originate in healthcare, humanizing systems involvement. Healthcare is a system, and involvement in any capacity of a system can be tough. And the cultural broker's role prioritizes safety, but it also is guided by the family's voice and choice. Traditional systems like child welfare haven't always practiced prioritizing cultural strengths, things like family networks, family-based supports, and community ties, which are all important for Black families. CCBs bring a lived experience, a cultural competence, and they uplift cultural strengths for families, pairing services that align with their values and needs and promoting safety and family preservation. So when we think about the video we just saw, who played the role of a cultural broker? I'm going to look out into the audience. I don't want to pick on folks. Anyone want to throw some things in the chat about what they saw and who was the broker? Let's see, I got to multitask. Kendrick, he sure was. We're on it after lunch. And in this instance, it was about finances. Peanut was making a business decision. But without Kendrick being in the middle of that, there were some vital things that could have been missed by both parties because Peanut wouldn't have been able to have that experience. And then also the gentleman sharing the financial advice wouldn't have been able to share that. Much of the work you will hear today has been done by communities in some form long before our pilot. Cultural brokering for us began in Fresno, California, when the community of West Fresno began advocating about the disproportionate representation of their neighborhood's children in the county child welfare system. This movement, led by Margaret Jackson, was invited to the Department of Social Services to attend meetings in their community and begin discussions with top administrators around concerns, birthing the Cultural Broker Family Advocate Program. Specifically, at the time in 2003, in Fresno County, Black children made up 5% of the general child population, but they made up 27% of the child welfare population. Now I'm going to turn it over to Lindsay to give us more about our pilot.
All righty, I'm back. So thank you for that, Mika, for the video. It was beautiful. Beautiful representation of what we do. So the concept, we spoke on Fresno, we spoke about Miss Margaret. Just going a little further, the Center for the Study of Social Policy worked closely with LA County Department of Children and Family Services and published an institutional analyst to develop and test approaches for improving the well-being of foster children and youth. The findings of this institutional analyst uplifted the need for programs that positively impacted the negative outcomes experienced by African American families and youth. And as we've discussed several times, the percentage, right, of African American families that are in the system. So we felt that, or they felt that there was a strong need for additional services. So with that, that small group of courageous people went to Fresno and met with Miss Margaret Jackson to discuss her lessons learned with the Cultural Broker Family Advocate Program, birthing, which then birthed the LA County Community Cultural Broker Program. After many iterations, Family First Prevention Services Act provided an opportunity for the community leaders and the department to learn from the program, as it has been standardized into a program that could be replicable and eventually an evidence-based practice that prioritizes culture. The partnerships that we have encountered right now, of course, we're still growing, but the partnerships currently led by Shields for Families and Faith Foster Families Network. The Community Culture Broker Pilot Program was launched with the Hawthorne Regional DCFS office. And we're, again, working to expand on our partnerships as well. Execution. So launching a pilot is awesome, of course, but it also requires a great amount of partnership, patience, and creative thinking. It also requires trust. Much like we ask of our families when we're working with systems, all of these things are prioritized by the pilot team. It's important that when you're working with families of your African American culture, that you build that trust, you build that rapport with families. Sometimes, going into it, families are very reluctant to, different programs, different services, especially if they feel you're attached to DCFS. So again, building that bridge with our families is crucial in the work that we do. The pilot team meets often to make sure every voice is included in the creation of deliverables, outcomes, pilot priorities, revisions, and overall discussion decision making. The vision that we have are the voices of those working hand in hand with families is prioritized. As a part of this pilot, the mission and vision you see on the screen was created in partnership with the American Institute for Research, but developed by words and actions of the community culture brokers. Easily explained, the vision of the community culture broker pilot is a world where Black children remain with their families in safe, loving environments while eliminating racial disparities. Our mission through all of this of the program is to advocate, empower, enhance teaming, engagement, and cultural understanding in child welfare. Our goal is to preserve our families, and racial equity must be prioritized for child welfare reform. We must prioritize keeping children safely with their families, ensure Black families receive support they need, and work toward a system that uplifts communities.
All right, I'll take it from here, Lindsay. Just wanted to share a few things. CCBs do more than just connect families to resources. We serve as trusted advocates, navigators, and cultural interpreters in a system that has historically marginalized Black voices. We help prevent unnecessary child removals, promote reunification, and ensure culturally responsive services, work that is crucial for racial equity in child welfare. Despite our impact, many of us operate in volunteer or underfunded roles, making it difficult to sustain our work long-term with families. When CCBs are underpaid, they face burnout, financial instability, and high turnover, which disrupts the continuity of support for families. Compensating CCBs as integral members of the child welfare team means that their work can be expanded and institutionalized rather than treated as an add-on. As a paid paraprofessional, there is a greater opportunity for training, supervision, and professional development, which will improve the quality of the services we provide for families. There is a human element that we provide with families as well that goes beyond just the day-to-day, just beyond just trying to be a culture broker with the family. We also ensure that we have clearer roles, that we're structured, that we have performance evaluations, and meaningful contributions that will be measured and impactful for each family. Whitney?
Thanks, Pastor Hadnot. So as the researcher in the room, I get to talk about a component of the program that isn't necessarily the most exciting, but certainly an important one, which is the role of data. Data is really critical to improving practice and in supporting our decisions around how do we maximize our efforts and how do we maximize limited resources to have the most benefit for the most people. But traditional data collection often fails to capture the full experience of Black families in the child welfare system. We often rely on data collected by systems or organizations without really collecting data about the experiences of families. And so we really, our AIR and our team has been working with this team to really understand how do we get data from families that speaks to their holistic experience and the result of their participation in this program. And data is really critical to ensuring that we're making the best use of our funding. We really have limited resources, and we want to maximize those resources in a way that best benefits families. And informing their decisions about what we choose to implement to support families who are involved with the system. And if we aren't tracking key indicators of racial disparities or the diverse needs of these families or efforts to support these families, we risk missing a very key piece of the puzzle about how programs impact families beyond just their case outcomes. And so that's why, as a team, we have been focusing on how to improve and standardize our data collections so we can better understand how the community cultural broker program works and how it impacts families, so we can start to build the evidence base for what works for Black families involved in the child welfare system, and ensure that our available funding is directed in ways that support effective and sustainable solutions that are responsive to the diverse needs of families and the communities that we serve. And our ultimate goal in our work together, our kind of long-term goal, is to get the program to a place and the evidence to a place where it would be eligible for review by the Title IV Prevention Services Clearinghouse, so that Black families involved with systems all over this country have access to a program that was specifically designed with their unique strengths and experiences in mind. With that, I think I'm turning it back over to you, Pastor Hadnot.
Yes, indeed. Thank you. When we thought about what makes the CCBs special, their engagement of families came to the forefront of our mind. Great priority is engaging with families. That's our priority as culture brokers. And we were able to have some training with motivational interviewing, which has given CCBs the skills to build trust and engage our clients in a way that acknowledges their unique experiences and cultural backgrounds, fostering a stronger sense of respect and connection, and holds them accountable for identifying changes they want to make and keeping those goals. It's very important that the cultural brokers work with the families in keeping the goals and staying on top of those goals. Reflective practice has also benefited CCBs by helping them build self-awareness, improve their skills, and provide more effective support to clients. They regularly reflect on their interactions, decisions, and challenges, allowing them to identify areas for growth, refine their approaches, and enhance their understanding of clients' unique needs. When service providers recognize and incorporate protective factors, they can better tailor their interventions to align with the strengths and values of the cultural group they are serving. Reflective practice also promotes problem solving and critical thinking, allowing paraprofessionals to learn from their experiences and continually adapt their techniques to better serve the communities they work with. Acknowledging these factors helps create a more holistic approach, empowering clients by building on what already exists within their cultural framework. For example, in communities where extended family is a key source of support, services can be designed to engage families in the process, fostering a sense of trust and collaboration. These strategies have enabled CCBs to build meaningful connections with families, foster trust, and improve overall family well-being. Big thing for us as cultural brokers is developing trust, building on that trust, keeping our word, and ensuring that we actually follow through on what we say we're going to do. Dr. Muhammad?
Working as a CCB in the community, we have learned lessons. Communities know best. We know best what is culturally responsive or practices are best administered to the CBOs. So when we're working out in the community, we want to make sure that when we're working with families, that they understand the process that they're working with and what our primary purpose for us being culture brokers will do for them and help them. Cultural culture as a connection is very important, because if I look like you and you look like me, you can understand what I'm going through and can better help me get through the maneuvers of the department that I need to do. If I don't have the opportunity to be able to hear what you're saying and know what you're saying, then it's a barrier for me in the process. What I say matters. Anytime I talk with a coach, family in the community, I make sure that my word is bond. It's very important that they'll be able to trust me and trust what I say. Initial engagement is a key. I have to respond quickly. We teach the culture brokers that we do not want time to lapse, because if they make up their mind that they want a culture broker to work with, then we should be available to work with them.
During this segment, we actually had a family or parent that we wanted to share information with. And that particular family and parent was unable to join us at this time. They ran into an emergency, so they won't be able to participate during the session. I can say that our assistance with this particular mother has been essential in ensuring that she stays on track with her plan with the CCB as it relates to time management, as it relates to prioritizing her goals, and ensuring that her and her children are reunified without child welfare impact. So that's something that's taking place right now with this young mother, and it continues to be essential that the CCB continues to be a part of their daily life. She's requiring, or at least she leans on our CCB for budgeting advice, resume building, has received employment as it relates to the CCB and her engagement over these past 5 to 6 months, as well as ensuring that there's been some food resources that's been provided for this particular family, as well as transportation needs. So there are several things that we do as it relates to providing resources for families as CCBs. And unfortunately, again, this mother wasn't able to join at this time, but she would be able to reiterate some of the things that I've just outlined as it relates to what we've been able to provide for her over the past few months, her and her children.
And since we were not able to have her present, I will go ahead and read another one of our success stories that we've had. We've had a few, which is awesome, but one that really, really stood out. So I will read that to you all. This client has been with us since February of 2024. This client is a community referral. The client has 4 children, age ranging from 16, 11, 10, and 9. The client's immediate needs were housing, employment, mental health assistance, DV classes for victims, and parenting classes. The client does not have custody of her children. The client lost parental rights while in the pilot program due to non-compliance of court-ordered assignments. Over the 12-month period the client was in the program, the CCB was able to assist the client with housing placement through Section 8 and secured a move-in fee of $1,500 through Watts Labor Community Action Committee, WLCAC. The client completed DV classes for victims, which was an 8-week class through WLCAC as well. The client was enrolled in parenting classes through Claris Health for 8 weeks. The client also currently receives mental health assistance through Kedron Health. In addition, the CCB was able to assist the client in employment by helping her with locating job opportunities and consistent encouragement on skills and abilities. The client also received bedding, comforter, and bed frame for herself through the efforts of the CCB and Care Portal. The CCB helped the client build trust and a can-do spirit, which will continue to drive the client to greater self-awareness and future accomplishments.
Thank you, Lizzie. As she stated, these are many, or one of many of the examples that we have for success stories in ensuring fathers and mothers reunify with their children, have resources made available to them, have a sense of dignity as it relates to them moving in and out of society. One of the great things that I think about our program is ensuring that people who feel as though they're on the fringes are brought back into the fold because of the sense of connection that community culture brokers are able to provide mother or father, and ensuring that that connection occurs through the resources, yes, finances, job, but also through community, churches, as well as just every day. Hey, I can get you into a men's group. I can get you into a woman's group. We can make sure that you have this type of connection so you don't feel isolated. And that's what our primary goal is, to ensure that families do not feel isolated and on the fringes, but again, brought back into the fold so that they can feel a part of society and meaningful relationships are brought to them and are extended to them so that they can feel a sense of family when they don't feel that on their own.
Dr. Muhammad, take us home. Ooh, and you on mute, sharing all that expert advice.
And I'm on mute. So looking at the grow work, expanding capacity building, when we are out in the community, the strength of the community, there's an old adage saying that it takes a village, and it definitely does take a village. We see that when we're out in the community and we're helping people in the community, that they have a sense of belonging. They know that somebody cares for them, that someone has their interest at best heart. And the opportunities that we get, we make friends in the community. They know that there's someone there that's going to guide them, that's going to help them, that's going to love on them if they need that. Whatever it is, we're there. The standardized process, ability to create and standardize the program in this process, roles and responsibility. The culture group is on an onboarding, how to come in and what they need to do. They get trained in how to interact with our families. They shadow the liaisons or the culture broker lead. So it just keeps growing and growing and growing and growing, because one person tells another person who tells another person. As we build evidence-based practice, the beautiful thing for me about working as a culture broker, because I started 20 years ago as a culture broker, has since then watched this grow. And watching it become evidence-based, I see firsthand the lives that are changed by the work that we do. That's not somebody just telling me, oh, did you know about this program? And they do this and this. I see this firsthand. I see what it's like when a family gets introduced to the Department of Children and Family Services and they don't know which way to go. And you get to grab their hand and help them walk through this. I've also been on the other end when there is a case coming to the department where the community can step in, the community culture brokers can step in, and a DCFS case is not open. That's my greatest accomplishment. Those are the things that we want to see. We want to see that the culture brokers make a difference, and that if we weren't there, what would happen? Improve data collection, standardizing the collection of data that captures the key ingredients that contribute to a successful outcome. Data, data, data. I'm a people person. I'm not a data person. I leave that to Whitney. Whitney's the data person. I'm a people person. But because I work with people, the data that we keep as culture broker during this pilot program, that the evidence of the numbers of how we have seen the decline, I have literally seen a decline, and I think Pastor Hadnot would agree with me, a decline of African-American children, our Black children, coming into the system, and as well as them going home, the children coming home quicker. So this program is my heart, and is the best program I think that we have in the whole wide world. And I have no doubt that through this pilot program that we will be entering into the clearinghouse soon.
Okay, we do have a little bit of extra time. So if there are any questions, I'm gonna grab them now. Oh, thank you, Pastor Hannah. Anything else? If not, we've got some extra time to hop around to to some additional workshops and hear about some other cool things. Oh, Deb. Yes, they are employed as a part of the pilot. Our cultural brokers are employed in the community through community-based organizations. They are employed, and I'll let Lindsay speak more about this process since she's had to do it. But yes, they are employed as a part of the pilot.
Yes. And so yes, this pilot, we do hire staff. Again, we do request that the family or the candidates have lived experience or directly or indirectly know someone that has gone through the system or has advocated for someone in the system. You have to have an hour for our criteria, a high school diploma. But again, lived experience is what we're looking for. I do know that there are other programs, such as Family Preservation, who are currently looking for CCBs as well to be hired in their programs because of the work that they see is happening here, the numbers, the rates that have gone down with the disproportionality. Other programs are trying to provide CCBs in their programs as well. So that's something you can look out for too. If you do know somebody, just start Googling, researching even family preservation for community culture brokers if you have folks that have this experience, lived experience. Someone else has a question.
Yeah, let's go. Funding. We've had to be very creative, Tiffany, with how we are funded, which is one of the disadvantages. And also one of the lessons that Whitney has taught me about the importance of data and data being connected to funding. And that brings sustainability to programs. A lot of the work has been a labor of love between regional offices and those that are in the prevention and aftercare space. So a lot of the work that the pilot team is doing to get us into an evidence-based practice will also mean that we will have a sustainable funding source. Let's see. And is this program the same as Parent Partner Program? No, but it is very similar. There's lots of really awesome parent partner programs, parent mentorship, parent support programs. The Parents in Partnership program that we have here at the department is a very similar program. Those parents with lived experience are now county employees. And so that's one of the real big distinctions is that they are employees of the department. Do you know how many counties use CCBs? In our research and background, we met with some of the other counties that use CCBs. There are cultural brokers in San Diego. There are cultural broker programs in Santa Clara. I think there's about 4, all very different and all serving different populations. That was one of the things that we learned when we had our cross-site meeting with the help of some friends at Casey Family Programs, is that we're all focusing on different populations. In some of the areas that have the cultural broker program, they see disproportionality and disparity in their Latinx families. And so they have a large serving for those families. Deb, training. I'm going to give training over to Dr. Muhammad. The training the cultural brokers go through, they have a standard 3-day training that was also adapted from the work that Miss Margaret does. And they also get to go through additional trainings between Dr. Muhammad and A New Vision for You, and then also at Shields for Families. They also go through some of their training too. So I'll throw it over to Dr. Muhammad first.
So some of the trainings that we do is that we now go into the homes, and so we train the culture brokers how to go into a home humbly. My ongoing thing to my staff is that we don't go to work, we go to serve. So we go with a service mentality, and when we go into someone's home, how to be respectful, how to interact with the family, how to interact if children are there. We help them with safety, how to be safe when you go into a home or when you go into a neighborhood, being safe, being aware, keeping themselves aware. We also train them on the Department of Children and Family Services, what their expectations are, what their language is, how they use what's that word you said y'all use, Mika, when y'all use acronyms? Because acronyms will throw you off if you don't know what you're looking for. So training them on the acronyms, and now that we have the Cultural Broker book, the handbook, it helps a lot. So we go through that daily. It's more or less too with the sense of you just treat people like you want to be treated. And we are a bridge between the community and the department. We don't go in trying to change the department's rules and regulations. We go in to be a service and to help the families that have to interact with them. So as far as training, I think it's ongoing. It's ongoing. Every day we learn something different. Every day we go to, if you go to court with somebody, something might happen that they bring back to somebody else that we would be like, oh, I didn't think about it like that, or you have an example of something. I had a culture broker, just to share a story with you very quickly, where they went into the family's home, and the person that went with them had a thing because the parent or the grandparent had sheets up to the window. Culture. She didn't understand why they had sheets up to the window, and why the beds didn't have sheets on the beds, because she was washing the sheets. She had a set of sheets for that, and they got to explain that to the person that went to the home with them, and it changed how that person looked at that family. They came up to the family's home and the grass was brown. Well, you can't water your grass in Lancaster. We live in Lancaster, California. There's a water regimen. So looking at those type of things, that to be sure that when we walk into the home with somebody who's coming from the department, to help, tilt their thinking a different type of way, and don't judge a book by its cover. You got to read the book. So training is an ongoing thing, and every day, trust me, I've been doing this 20 years, every day you learn something different.
I just wanted to uplift. I think someone had a question, wanted to ask. I'm not sure, Susan, if you still were interested in asking a question.
Thank you. Thank you. We have this new AV equipment here, and I was not sure if you could hear me, but yes, thank you very much. I think that this program is amazing, and we're your neighbors. We're right next door in Kern County. So I'm actually talking to you from Mojave. You probably know us. And we're very much in our main offices in Bakersfield, and we're very much interested in, engaging with cultural brokers here. We were told that we would have to have an organization interested in the Bakersfield area or in Kern County that you would work with and that you would train. So I just wanted to get a little bit of information about that. And also we wanted to use cultural brokers very intentionally in terms of recruiting more relatives to take placement, especially, here in our communities, because I don't think that the information is there, and especially the relationships are not there. So there's that distrust, and it's understandable, and we have to, you know, just kind of address that distrust by building that bridge. But I think that it would be best if we are very intentional and like coming at it from inside of the community with culture brokers. So I'm going to land my plane there, and if you could help us bring cultural brokers to Kern County.
Love
That's
all of
very
them.
interesting. That's very interesting that you say that, because one of my families in Lancaster had a family up in Kern County in Bakersfield who she had told about the program, and so the person called me from there to ask me about the program and how I could help. And this was just like 3 weeks ago, how I could help their family. The family was actually coming from there to come to Lancaster. So I was able to help bridge that gap. So when they transferred that case to there, when that person arrived, they arrived with a cultural broker. So it has traveled up there.
I threw my email in the chat that is for everyone to use. Susan, please shoot me an email. I would love to talk more with you and your team and our team about what our experiences have been. I think I don't remember who on the team shared it, but sometimes the community culture broker world kind of feels like the wild, wild west, because we've all been doing like really awesome work for so long, but there's never been a manual or a little bit of guidance for us to follow. And so I think us joining forces as we're on our way to standardizing this would be awesome. So yes, please shoot me an email. I would love to talk to you and your team.
Oh, we definitely will. Thank you so much.
Absolutely. Anything else?
I had a couple of questions actually. One was, I guess, around this like standardization of like your curriculum. I was just curious about, you know, how you all developed that. And then also as part of just your data tracking, are you tracking like the recidivism for families that use cultural broker program?
So Lydia, I'm going to turn most of that over to Whitney to talk about our struggles with data. And then I'll jump into also, because the recidivism thing has come up a lot for our team. What we encountered on our data journey, very similar to what Dr. Muhammad mentioned earlier. Black communities are more qualitative, not quantitative. So there's tons of stories about the success of families, and there are tons of stories about how a broker has positively impacted a family and they didn't come back into the system. But because we haven't operated the program in a way that we are now, we need to rebuild that data to tell that story. So I'll give it over to Whitney.
Yeah, so one of the things that we're excited to be working on this year, kind of in the first year, we were really focused on the program manual. We're moving into developing a training guide, also really to standardize the practice across the county, and also to spread the good practice all over the state and all over the country. But a big piece of our work this year is really preparing the program for evaluation. Standardizing the program and the training is part of that, but also building the data infrastructure is a big piece of that. I know Dr. Muhammad said data is not your favorite thing. It's not everybody's jam, but it is critical to be able to track the outcomes. Something that LA has struggled with, and I'm guessing this isn't unique to LA or to California, of being able to track families who are referred to community-based organizations and being able to link them back into their child welfare data is a struggle. And so we are working with LA County right now to figure out a better way of being able to track families so we can track their child welfare outcomes. Obviously, we are kind of eyeing the clearinghouse, and the child welfare outcomes are one of those outcomes that is of interest to the clearinghouse. So we're trying to prepare LA for that type of evaluation. So data infrastructure is a big focus of this year to prepare for that.
Thank you. I'm always curious just to see how do we know the programs we're utilizing are helping families, like who's better off because of the work we're doing, which I have no doubt that families are better off, but I think like you said, Mika, before, like how do we convince the funders that families are better off because of the wonderful work you are all doing? So I definitely appreciate that. And quantitative data is not as exciting as the qualitative stuff, of course. But sometimes we just have to learn how to coexist with it.
The one other thing I'll say about the data too, obviously the child welfare outcomes are important, but we are also not just building like a data infrastructure to be able to link families back to their child welfare data, but also, again, like back to what I was talking about, like really collecting like holistic data, holistic data that can capture the holistic experience of families and all of the great things that the cultural brokers do, really wanting to capture the mechanisms through which we think the program is effective. Because there's going to be other things that, you know, affect child welfare case outcomes. So we want to be able to track those other indicators of success. And so it's not just the child welfare data. We are thinking about how cultural brokers work with families to change, to really increase those protective factors, reduce risk factors. So we will be looking to standardize and pilot some of those data collection practices too.
We have our work cut out for us. Please send all the good vibes, uplift us, for those who are faith, send all the prayers. Thank you, Whitney. Oh, thanks, Daniela.
Can I just ask Whitney another question about the data? Because of, you know, most of the counties are getting ready to roll out the CANS, or the Child and Adolescent Needs Strengths Assessment. So have you considered looking at the CANS as a method of tracking data in terms of seeing if there are any like improvements, since it is kind of an evidence-based method? So if you integrate that into your practice, you can track, you know, improvements in a child's behavior, in a child's well-being.
Yeah, we haven't talked about it, but I think that's a great suggestion. Our goal with any data collection is to reduce burden on people as much as possible. Nobody wants to really collect this data or have to enter this data, and that's often why we get kind of poor quality of data. You know, people just it's just not the funnest part of your job. And so we are trying to utilize and leverage data that's already going to be collected as much as possible. This is why we lean so heavily on child welfare data, right? Because their systems are mandated to collect it. But if there's a standardized, like if we have standardized data on every family who's coming who's participating in the program, we will certainly explore leveraging that data, because I think the CANS is really great data that tracks the family progress.
And we also, just to reiterate, we do use the protective factor survey, and we reassess with that as well. So that will help with data collection moving forward as well.
Also to shout out Lisa in the chat, some data and some successes. So thank you for that, Lisa.
Thank you.
Anything else? This has been really cool. Pastor Hadnot, I saw you on mic.
No, just the opportunity to have families come by and do visitations as part of the cultural broker work is very important as well. Helping mothers in particular, and fathers, I should say, build self-esteem, and again, that connection, being able to not only just speak with a social worker, but also expand who will provide them support, who can they talk to, who can be an outlet for them, is what the culture broker team is all about. And we ensure that they do have that connection and make that connection with more than just the social worker and just dealing with their case. I just got to deal with my case and my situation. It's okay, I have another outlet. I can build relationships. I can have a spiritual enlightenment opportunity with the church. I can have a men's group that likes to go bowling, right? That now we connect them to. So these are some things that the community culture broker is able to assist and build that bridge, be a mediator, and again, just make connections. That's what we really are trying to do with mothers and fathers.
And let me add to that. Historically, we work a lot with women and mothers, and fathers get ignored or not looked at. And having the Culture Broker program and the Father Strong program that we work together with helps with the fathers, because we have a lot of single fathers who have their children, who have their daughters, who perhaps don't know how to comb hair and need to learn how to braid. And I just had a father who literally went to a braiding class so he could learn how to braid his 3 daughters' hair. And he was so excited to let me know that he had completed the class and then took pictures of his daughters to send it to me to let me see that and so I didn't believe him. Asked his daughter, I said, did your daddy really braid your hair? And she was like, yes, ma'am, he did. It took him a long time. And so we laughed about that because he had to learn the technique of that. But having a male cultural broker who worked with this father to help this father to learn how to shop. He didn't know how to grocery shop. He said, because he just liked noodles and hot dogs, and he would feed his children that. And we told him, you can't just feed them noodles and hot dogs. But he did the necessary things, but having a male cultural broker really helped him, because this culture broker, he's married, he has a wife with children, so it showed him the sense of family. So I was so proud that he learned how to braid hair, that I can't braid hair. So I was really proud that he took a class to learn how to braid hair. So those are just some of the extra things that we can get joy in, especially working with fathers and having them being able to trust the process of the culture brokers.
With that, I'm never going to come behind Dr. Muhammad or Pastor Hadnot. Those are my leaders in this work. So thank y'all for joining our session. If you have any questions, again, my info is in the chat and I can connect y'all with our team. Have a great rest of your Wednesday.
Thank you all for attending. This recording will be on the Whova app within a week, or you can find it on the Strategies Technical Assistance YouTube channel. We'll have it there as well.
Thank you.